Hi, this is Jamie McGregar. We're here at the Society for Maternal Fetal Medicine here in Dallas. It's February 1st. I'm here with Dr. Kim Boggess. She's a professor at the University of North Carolina, and she's one of the world leaders in terms of understanding the importance of periodontal infection and the interaction with preterm birth. And she's here with her poster. And Kim, could you tell us a little bit, how are we doing in terms of preventing preterm birth by approaches based on periodontal disease?
What we've learned over the last 10 years of study is that women who have chronic oral infections and poor oral health do have a higher rate of adverse pregnancy outcomes: premature birth, preeclampsia, and delivery of a small for gestational age baby.
So those three things: preterm birth, SGA, and preeclampsia.
Yes. And what we don't know is the biologic mechanism, but we believe it's a combination of maternal and fetal inflammatory and immune responses to the chronic exposure to the oral infection. We know that women who are treated for periodontal disease during pregnancy, in some studies, has been shown to improve pregnancy outcomes. And so what the key areas of research right now are to try to identify the women for whom we should be targeting prevention and treatment therapies.
In those studies, was it as a simple thing like giving an antibiotic, or did you actually have to do a periodontal treatment?
Women have to go to a licensed dentist or periodontist for the therapy, which is called scaling and root planing of the oral surfaces of the teeth.
I must say, we've followed your research closely in Colorado, and we've actually got the Dental Society on the Western Slope to volunteer 40 visits a month in terms of examining pregnant women for very bad 3 to 4 plus periodontal disease.
That's wonderful, and you can be commended for that, because that's very progressive, and that will not only help women in their pregnancies, but there's a significant amount of research that's linking poor oral health to other chronic diseases such as diabetes and heart disease and respiratory infections, and also the increasing amount of information that we're gaining about maternal oral health and subsequent child oral health, because dental caries is the most common childhood illness, and it is an infectious disease which is transmitted from mother to child.
Do you mean organisms like strep mutans could actually be transmitted orally from the mother to the baby?
That is correct.
And can we interfere with that transmission?
Well, we and others are now doing studies to determine what level of prevention and treatment we can institute to break the cycle of infection from mother to child, because then these children grow up, and if they're female children, they grow up and have babies, and if they have poor oral health, it then perpetuates the cycle
into the
again.
Next generation.
Correct.
So this is really critical information for all of us, because we're talking about something that's identifiable. We're not talking about a little bit of gingivitis or periodontal disease. We're talking about 3 or 4 plus.
Correct.
And you've stated that actually this should be incorporated in terms of regular prenatal care, perhaps preconception care, and that in fact the treatment is safe in pregnancy and effective in reducing the complications of preterm birth, SGA, perhaps preeclampsia in these groups of women.
Right. I think it would be wonderful to incorporate screening and treatment into all of our practices, but the reality is the delivery of services to do that is at this point in time going to be a big challenge, and so I would caution comprehensive programs to do that until we understand better, one, the relationship, and two, what kind of impact our interventions do have. But I think from a general health standpoint, all women should have regular oral health visits, because there is well-documented evidence about lifelong health benefits.
So heart, obesity, the load of inflammation?
Correct.
Thank you very much. You've been a real leader in these areas, and we want to thank you.
Thank you for your time.